Presiding Officer, our NHS faces a national crisis in what is known as corridor care, where patients are treated on trolleys in corridors because there simply are not enough beds in wards for them. And this week, the Royal College of Emergency Medicine published new analysis which found that on average 45% of patients treated in our emergency departments didn't have access to a private cubicle. In their words, when no cubicle is available, patients are treated in other areas. Trolleys in corridors, cars, the waiting rooms, relative rooms, plaster rooms. Imagine you or one of your loved ones lying on a trolley for hours. No privacy, no dignity, just pain and distress. After 17 years of this SNP government, why has corridor care become such commonplace?
First Minister.
Presiding Officer, as Mr Sarwar will know, the issues in relation to the National Health Service are driven by, the challenges in the National Health Service today are driven by a number of factors. One of them is the increase in demand in the aftermath of COVID, which the National Health Service is doing its level best to try to address. We are wrestling also with the challenges of our hospitals being significantly congested because of the challenges around delayed discharge, which come largely from the fact that we do not have enough social care packages available in the community because we don't have enough people in the workforce to deliver the volume of social care packages that are required. And that is a consequence of the loss of population because of the loss of free movement under Brexit. So the issues that we are wrestling with are significant and acute, and the Government and our health boards are focused on addressing that. But finally, let me say to Mr Sarwar that if anybody is treated in the fashion that he has recounted, and I've seen media reports this morning of a particular case at the Queen Elizabeth University Hospital, then I apologise unreservedly to anybody who has that experience and assure members of the public and their families that the Government is doing all that it possibly can do to address that circumstance.
Anas Sarwar.
I've been coming to this chamber week after week for the last 3 years, and week after week we've been hearing apologies from SNP First Ministers, and then we just get apologies the week after, and the week after nothing actually changes in terms of people's lived experience. But let's be clear, long waits cost lives. The Royal College of Emergency Medicine have warned that for every 72 patients who wait over 8 hours in A&E, there will be one excess death. That's a death that could be avoided if the patient had been treated on time. That means so far this year, more than 1,000 Scots have died who could have been saved had they been treated on time. 1,000 avoidable deaths. 1,000 people so far this year alone, and it's only June, First Minister. Those are fathers and mothers, sons and daughters who died because they couldn't get their care on time. Why have these families been so badly let down by this SNP government? First Minister.
In my earlier answer, I set out some of the issues that are driving this particular situation. And those issues are, to repeat them, the increase in demand after COVID, the congestion in our hospitals. Hospitals are now in excess of 95% occupancy, which is far, far too high. It should be about 10% lower than that for ordinary activity. And the absence of adequate social care capacity within the community, because we quite simply do not have enough social care workers to deliver those packages. So that is the explanation of the problem. And Mr Sarwar says to me that he comes here week after week to raise these issues, and I know that he does, and he gets these answers. But what it does is it requires us to take action. So this government has taken action. This government has taken the action of increasing tax on higher earners to boost investment in the National Health Service. The National Health Service would have lower money available to it if this government had not taken the hard decisions on tax. And we have an opportunity, as a consequence of the general election, to do something about it, to encourage more people to be in the labour force, which would require us to reintroduce freedom of movement so that people could come to work in this country, or to encourage more investment and to take more investment decisions, like ending austerity. And of course, what Mr Sarwar's party is proposing is no answer on those questions. In fact, they're proposing the reverse. They're saying we'll maintain Brexit and we'll maintain austerity. That's not good enough. It's time for the Labour Party to act.
Anas Sarwar.
For a politician to have been in power for 17 years, and that's the best answer he can give, I think has to take a really serious look in the mirror. And in actual fact, it was John Swinney as Finance Secretary that cut local government budgets and cut social care budgets across the country, so perhaps some reflection on his own record. Because the reality, Presiding Officer, is that patients and staff have been failed and let down by this SNP government. And a few weeks ago, the Royal College of Nursing reported on this issue as well, and quoted a Scottish nurse. And let me quote that nurse. "We don't complain for ourselves, but for the patient. There are no screens to go round the patient, so if they are being bed-bathed or need a bedpan, you have to take a patient out of their bed space and move them into a corridor. Then move the extra patient into the bed space to use the bedpan. It's time-consuming, there is not enough space in the rooms, and it's undignified for the patient." This is the unbearable situation that is such an unfairness to the patients and staff. So, First Minister, directly to this nurse, explain to this heartbroken nurse why you and your government continues to let them down so badly.
Always through the chair. First Minister.
I've explained what the challenge and the difficulty is, and the Government has taken the action of increasing taxation for higher earners to invest more in the National Health Service than would have been the case had we just passed on the consequentials from UK funding. So we have taken the hard decisions, and there was, of course, a time when Mr Sarwar would have supported us, but Mr Sarwar has now U-turned on that position, and Mr Sarwar now wants to cut the money available to the public finances as a consequence of what he said on Tuesday. Now, Mr Sarwar is shaking his head at me. Mr Sarwar obviously doesn't understand what he was saying at his press conference on Tuesday, because what the consequences of his stance will be to reduce public expenditure in Scotland. So it is quite simply beyond credibility to come here and ask me to invest more money in the National Health Service to tackle the issues that Mr Sarwar is concerned about when he wants to cut public expenditure and any prospective incoming United Kingdom government will also be cutting public expenditure. So my answer to that nurse is that we've got to have an end to austerity, and she won't get it from the Labour government.